My name is Chaotic Evil, and I make videos on all things cannabis. As you probably guessed from the title of this video, today we will be discussing cannabis as a form of supplemental treatment for the ED anorexia nervosa. If you think discussion about that topic could be in any way triggering to you, maybe skip this video. According to the National Eating Disorders Association, in a study of more than 2,400 individuals hospitalized for an eating disorder, 94% of participants had a co-occurring mood disorder, 92% of those having depressive disorders. These complicated and overlapping disorders make treatment a very delicate process, navigating significant imbalances in brain chemistry. You can also be genetically predisposed to develop anorexia, but it's still unclear how much influence that has in practice, combined with environmental and cultural factors. As of now, research suggests somewhere between 28 to 74% of the risk of eating disorders generally occurs through genetic heritability. Anorexia nervosa is incredibly damaging to both your physical and mental health, and is incredibly difficult to cure. It is referred to as the deadliest of all psychiatric disorders, with a 10% mortality rate due to risk of starvation, organ failure, and suicide. As a collective, approximately 10,200 deaths in America each year are the direct result of an eating disorder. The current available pharmaceutical options for treating anorexia overlap with treatment options for anxiety and depression. This includes SSRIs like Zoloft and Lexapro, which can cause insomnia, sleepiness, stomach issues, and sexual dysfunction, among many others. I can speak from personal experience. Other options include benzodiazepines like lorazepam, which require increased doses for long-term use to remain effective, or tricyclic antidepressants, which can cause hypotension, constipation, urinary retention, dry mouth, and blurry vision. Given these current options, researchers and doctors alike have increasingly moved towards cannabis as a possible alternate treatment option. Two aspects of the brain are to thank for processing sensory information about food, taste, and hunger: the insula and the endocannabinoid system. The endocannabinoid system processes the information, including flavor, temperature, intestinal tension, and our appetite. CB1 receptors present in our endocannabinoid systems bind to the cannabinoid ingested and trigger our appetites. The insula then controls the pleasure we receive from eating and imprints that pleasure in our memories so we're compelled to eat again. For an anorexic patient in critical condition that needs to intake calories, cannabis could be a significantly less traumatic alternative to employing a feeding tube by force. It is also much more beneficial to the eventual treatment process if the patient chooses to consume food, rather than being forced to. Using cannabis as a part of a treatment plan for anorexia is likely to be more beneficial than for other eating disorders, most notably those where sufferers binge and purge. But for patients struggling to consume food, it could be a real game changer in their recovery journey. Unfortunately, this treatment option is inaccessible for many U.S. citizens as well as in countries around the globe due to antiquated, restrictive cannabis laws. And despite credible medical research and millennia of historical evidence, cannabis is still not regarded as a legitimate medical treatment plan in Western culture. This has been and will continue to be extremely damaging to those with anorexia. Eating disorders have no prejudices. Though often depicted in the media through young, white women who fit traditional European beauty standards, they are complicated and dangerous diseases that 2.8 million Americans, 9% of the U.S. population, will experience in their lifetime. We need the federal government to legalize cannabis as soon as possible. It is not enough to continue to expand individual programs state by state, particularly because legalization has been and continues to be treated as a political issue. It isn't, and doing so robs millions of what could be a life-saving treatment. For more information about obtaining a medical marijuana card, you can visit. There will be additional resources linked in the description box below, as well as all of the sources I used to create this video. If you're struggling with anorexia or suspect a friend or family member might be struggling, please do not hesitate to get help. Thank you for watching. Take care of yourselves. Bye.